finish this PowerPoint, just I don't know why I'm blanking on what chapter this is, but about like a secure attachment. So, and then watching just the beginning of Paper Tigers. So hopefully it will let it go on YouTube Live. So, do you have any questions? Okay. Um, so learning self-regulation, actually with trauma, and I have a series of PowerPoints on trauma, childhood trauma, and like adolescent trauma, and learning how to self-regulate. Um, but this one actually is more of a baby self-regulation. That's asking what age can a baby obey when not in the presence of others? What role does the process of self-referencing play in self-regulation of behavior, and the responses of others influence moral development, but the implication can be to avoid certain responses. So dependent on the way the child's brought up, it actually may the age might differ. So they might um, have different ages where they you like leave them alone in a room and you're like, don't eat those marshmallows, which is hard to do at age 2, 3, and 4. But some of them could learn it by age 5, and it again depends on the way they were brought up and like their parenting. So attachment problems. I wanted to get into this before Paper Tigers because if they have a failure to form an attachment, either neither parent is present or only one parent is present but not really available. Um, then they could have failure to thrive. Some of that could show up in weight. So, like if the child's weight is below the 5% for the age, that could either be organic or non organic, um, which means it's psychological, emotional deprivation or difficult family situations, which you're about to watch the first half of the movie on, the documentary. And then this shows kind of the cycle, circular influences in the family. So, like, if mom and dad are fighting, like marital influences, um, parents, baby sees that and has a response, then there's family stress, then sometimes they're fighting again about that family stress. So it kind of can build on itself. And then the last slide is some of the helpful things is, well, father involvement and mother involvement. They say father involvement because research shows more likely the father would be uninvolved. Um, so needing social support, a lot of times maternal grandmother will help out with baby, playing with the baby. Um, Adoptions can be both open and closed. So like the birth parents get to see the child, and I've shown some videos on that before too. Or the birth parents don't get to see the child until the baby's 18 and they can go find the parents. Daycare is a way that there is less parent involvement, but some people don't have a choice. Infant abuse can happen if the parents aren't trained properly. So, and that's kind of what we're getting into in the movie Paper Tigers. Um, and then, so in an appropriate environment, you'll be able to read what the baby needs. Are they hungry? Are their diapers wet? Are they uh, needing a diaper change? Are they tired? Do they need a nap? Playing at the appropriate times. Um, so there are tools for social workers. It's called the home observation for measurement of the environment. And some social workers will use that. All right, this is, have you ever seen Paper Tigers? Oh, you have seen it. Okay. So would it be better for me not to show it? Okay. Because I feel like most people have Amazon Prime and then it would be free. But if you've already seen it, though, I almost feel like we could be more efficient. And it's totally up to you. When did we watch it? Was it in the intro to social work class last year? Okay. Right. Yeah. So that's getting into traumas and things of that nature. And you're right, maybe it would be better to show when other folks are here. We have, I feel like we're already on 5 or 6. And that's Yeah, this would probably be it because it's early childhood. So this is probably more appropriate to begin and then get into for um, for paper tigers because most of them are, well, some of the abuse and trauma started in early childhood. So developmentally, this is when you develop your independence from physical care to self-care and social compliance. There actually is one I would show you guys that has more to do with um, secure attachments. And this one is specific to like the research on secure and insecure attachments from the end of last chapter. So a secure attachment, this is the test they started doing in the 1960s. And is that all videos? I want to make sure it has some directive. So how a mom can achieve a secure
All
attachment.
of my clients had exactly the same problem where there was a millionaire, a movie star.
Why am I single when I'm doing everything right? Different forms of this question pop up. How can I heal myself so that I can be healed enough? Well,
She's actually just talking the whole time, so I'm not going to do that one. I want one that actually shows the experiment that they did, which, so yeah, this is for scientific purposes. So in the 60s, they did, oh, I forgot, you can't see it unless if I drag it over.
here on the side, should we make it wide? I'm gonna try to put that on top.
Or no, that's right, you got it, okay.
Oh, it's gonna fall. Ah, put that way up on the top. Watch what's gonna happen. Susie.
So in these experiments from the 60s, they would first show mom just playing with the baby, and then mom would walk away. Sometimes a stranger would come in before mom left, and then mom leaves, and they see how the baby reacts. And then the stranger tries to play with the baby, and then calms it down, whatever, and then mom comes back and they see how the baby reacts to determine if they have secure attachment, insecure attachment, or a negative attachment. So let's see if this one.
The attachment theory argues that a strong emotional and physical bond to one primary caregiver in our first years of life is critical to our development. If our bonding is strong and we are securely attached, then we feel safe to explore the world. We know that there is always that safe base, which we can return to any time. If our bond is weak, we feel insecurely attached. We are afraid to leave or explore a rather scary-looking world because we are not sure if we can return. People who are securely attached are said to have greater trust, can connect to others, and as a result are more successful in life. Insecurely attached people tend to mistrust others, lack social skills, and have problems forming relationships. There is one type of secure attachment, and there are 3 types of insecure attachments: anxious ambivalent, anxious avoidant, and anxious disorganized. In responses to distress, the first 3 react organized, while the last acts disorganized. To understand the theory better, let's look at Mr. and Mrs. Smith, who have 4 children: Luca, Anne, Joe, and Amy. The Smiths are lovely parents who cuddle, make frequent eye contact, speak warmly, and are always there for their kids. But one day, Mr. Smith falls very sick and dies. For Mrs. Smith, life now becomes very difficult. She spends all day working, while at the same time trying to care for her children. An impossible task. At 6 years of age, Luca's brain is for the most part developed, his character strong and his worldview shaped. The new situation does not affect him much. He knows there is still always Mum, his safe haven. He feels securely attached. Later, he turns into a trusting and optimistic young man. His self-image is positive. Anne, who is 3, has problems coping with the new lack of attention. To Anne, her mother now acts unpredictably. She is anxious about their relationship and as a result becomes clingy. To get her mum's attention, she has to raise her emotional state and scream. When her mum finally reacts with a predictable response, she herself acts ambivalent and doesn't show her true feelings. Later in life, others think Anne is unpredictable or moody. Her self-image is less positive. Her attachment style is anxious ambivalent. 2-year-old.
So it can affect your relationships in the future, which is interesting. So from that 3-year-old insecure attachment, the way you create relationships into the future changes, the way they're describing it.
Joe spends his days with his uncle, who loves him, but thinks that a good education means being strict. If little Joe shows too much emotion or is too loud, his uncle gets angry and sometimes punitive. This scares Joe. He learns that to avoid fear, he has to avoid showing his feelings, also in other situations. As an adult, he continues this strategy and has problems entering relationships. His image of himself is rather negative. His attachment is anxious avoidant. Amy, who is just 1 year old, gets sent to a nursery. The staff there is poorly trained, overworked, and often very stressed. Some are outright abusive. Amy therefore becomes anxious of the very people she seeks security from, a conflict which totally disorganizes her ideas about love and safety. As she is experiencing fear without resolution, she tries to avoid all social situations. As an adult, she thinks of herself as unworthy of love. Her self-image is very negative. Her attachment is anxious, disorganized. Our attachment is formed in the very first years of our lives, a time when we are too young to communicate our anxiety, and as a result, can experience high levels of stress. Then our adrenal gland, an organ sitting on top of our kidneys, produces the stress hormones adrenaline and cortisol. The heart rate increases, the blood pressure goes up, and we become alert. If that happens frequently, it is called toxic stress. Toxic because it impairs the development of a child's brain and weakens the immune system. In embryos or at a very young age, toxic stress can even switch the expressions of genes, which can affect our health many decades later. By simulating a strange situation, we can assess an attachment style already by the age of 1.
So this is the experiment that became popularized in the 60s. It was called Strange Situation, where mom's playing with kid, stranger walks in, also gets to meet kid, mom walks out, and I'll probably explain it.
To do this, we let the child play with their mother for a few minutes inside a room. Then the child is left alone. The key moment is the child's reaction when her mother returns. Securely attached children first usually hug their mother, then can calm down and eventually get back to playing. Insecurely attached children can be ambivalent and avoidant. Some can't stop crying or refuse to continue playing. The long-term effects of our attachment in the early years are well documented. Using the theory, researchers at Minnesota University were able to predict already at age 3 if a child would drop out of high school with 77% accuracy. In another study, undergraduates at Harvard were asked to assess how close they felt to their parents. 35 years later, they were asked about their health. 91% of those who said they had a rather broken relationship with their mother were also diagnosed with health issues, including coronary artery disease, hypertension, and alcoholism. For those that had reported a warm relationship, the figure of poor health diagnosis was just 45%. But there is another reason why the early years deserve special attention. They are the starting place for subsequent behaviors. A kid that feels securely attached at age 2 can make friends at kindergarten. Their worldview gets reinforced with every interaction, and they develop optimism. As a result, they make good relationships at school, then at college, and later at work. Highly insecurely attached children can miss out on this opportunity. Psychologist John Bowlby, a pioneer in attachment theory, allegedly said, "What cannot be communicated to the mother cannot be communicated to the self." In other words, those who feel insecurely attached might not quite understand themselves. To get to know who they are and what they feel, they might have to go way back in time.
So I mentioned reading the description, if I'm able to. I'm going to scroll down. So attachment theory argues strong emotional and physical bond to one primary caregiver. So it doesn't have to be the mother, it could be the father. In our first years of life is critical to development. If our bonding is strong and we are securely attached, then we feel safe to explore the world. If our bond is weak, we feel insecurely attached, afraid to leave or explore a rather scary looking world because we are not sure if we can return. Often we don't understand our feelings. So yeah, there's several ways they talk about dealing with the attachment issues. Therapies you can go through are psychoanalysis, cognitive behavior therapy, which is probably one of the most popular, CBT with like a private practice, or the Hoffman process. That's only 8 days. It's a guided process designed by the American psychologist Hoffman, brings participants back into their childhood to reconnect with their parents at a time when attachment is formed. Very intensive and could potentially be harmful if no proper supervision is being offered the month after. So, have you ever heard of the attachment theory? So it's a big one a lot of people use. And there's a lot of different research on it. So I always try to connect with one or two.
So can you like see as a teenager or a young adult and be like, you're insecure avoidance based on like how they act now?
That is what they're saying. So yeah, they do different research studies to show how you interact. Like if you're avoidant, you might less likely get involved in a relationship. Well, here's one about dating relationships. So this is like a secure attachment. This is just like a quick one. It's only a minute. So
secure individuals show a healthy balance of healthy attachment behaviors on the one hand and healthy exploratory behaviors on the other hand in relationships, in intimate relationships. It's clear that they are comfortable with closeness and with mutual dependency. They actively seek emotional support from their partners, and they can actively initiate and give emotional support to their partners. They are also comfortable being alone. It's not a source of undue discomfort if they're alone. They can tolerate it, and they can use that time independently to explore and get things done. They have a strong sense of themselves, both individually and in the context of keeping that strong sense of self in the relationship. They're often very reflective on the relationship and the intimacy of that relationship, so they have good metacognitive capacity to reflect on how they're being in a relationship. They have a strong capacity to trust in relationships, and they are open with their feelings in relationships. Mostly they'll be positive about relationships in their descriptions. They have a lot of positive feelings about intimacy. And they clearly show in the way they talk about relationships that they strongly value intimacy and attachment. And if they enter therapy about relationship issues, they see the therapist as a secure base and as a strong working reliance develops.
So that was more secure attachments. And what we're saying is the first few years of life, your attachment to your mother or attachment to your father, whoever is the primary caregiver, can determine if you'll have types of relationships further on into the future. And they've done a lot of research on it. One way they found out about secure attachments is this experiment in the 50s and the 60s by Dr. John Bowlby. So I'll show this one where they have mom in the room and then she leaves and how the baby reacts when she comes back.
John Bowlby was a British psychologist, and he became extremely interested in child-mother separation during the bombing of London. Bombing of London, a lot of parents sent their kids to the safety of the countryside. And the kids were with safe people. They were well cared for. They were well fed, but they still had a very negative response to the separation from their mothers. At that point, he looked at the biology that was emerging in primatology. A monkey infant gets almost all its nutrition in the first 2 or 3 months of life from its mother, from lactation. But the infant who's weaned still seeks proximity. You'll see the infant reach out and touch the mom's tail or touch its coat. There's a continuing lifelong desire for proximity and contact. And Bowlby and others have seen that proximity seeking and that contact seeking as being cornerstones of what they call attachment behavior.
In the first part of the 20th century, behaviorists and psychoanalysts claimed that babies love their parents because you don't want to bite the hand that feeds you. The innovation of Bowlby was to observe that that can't be all. That what the child needs is not only to be fed, but also to be held by an understanding, sensitive, and responsive adult. And that optimal social and mental health outcomes will follow from that. 60 or more years on now, we have a half century of evidence showing that he was more or less right.
Our program at the Center for Babies, Toddlers, and Families is really based on the theories of John Bowlby, with the idea that we really need to help parents and children form a secure attachment. So oftentimes, families are referred to us when the parents have had very difficult childhoods themselves and are really struggling in this role of being a parent.
Like I said, I never had a mommy. I was never taught how to take care of anybody or myself. So it's like very hard. Like I wouldn't have patience, like the crying, like I would, scream at her and stuff like that,
For many parents who really were neglected as children, hearing a baby cry triggers in them their own feelings of that unrelenting crying that they did. So for Pearl, it was very, very difficult for her to be able to meet her child's needs. We've partnered with the Center for Attachment Research at the new school for a series of attachment measures to test that our intervention is effective.
So come on in, Pearl. So just put her down and let her have a go at whatever she wants to do in here. Okay? We measure the attachment relationship with a laboratory scenario that takes 20 minutes. The critical point is where the mother gets a cue to leave the room.
Bye, baby girl. See you later.
Some children look on the outside like they're very independent and seem not to notice, but physiologically are very aroused and stay aroused even in the presence of when that caregiver returns. By contrast, the securely attached child often notices, cries when the caregiver leaves, And when the caregiver comes back, easily turns to the caregiver and looks at the caregiver to be comforted. And then they can get back to some kind of homeostasis. We think this response is one of the hallmarks of mental health.
What is so interesting about childhood development is that we know a lot about the long-term, lifelong consequences of early life adversity, ranging from psychological effects like substance abuse and depression, but also biological consequences like increased incidence of cardiovascular disease, diabetes, and a whole host of other physical ailments. One of the things we know that can lead down the path towards cardiovascular disease is chronic inflammation. Inflammation is a biological response that helps the body counteract an infection. The body produces chemicals which activate the immune system and allow it to get rid of the infective agent when the infection is contained. The body calls forth cortisol to try to turn down the inflammation. Now, this is all good, but there are situations, especially connected with traumatic experiences, in which that cortisol response doesn't happen. So these people who had these adverse early life experiences had elevated levels of inflammation, which is at the heart of cardiovascular disease. So cortisol is very important.
The way that we measure cortisol is through a saliva sample obtained on arrival at the lab and at the end of the lab visit. And our goal is to, over time, impact patterns of cortisol.
Is that okay?
At our initial measurements of these families when they were beginning the intervention, we see very low levels of attachment security as measured by their behavior. But when we look at families who participated for 6 months or more, we see attachment security at 70%, the same levels seen worldwide.
Yeah.
Because higher levels of attachment security correlate with more normal cortisol responses. We're hoping to see their cortisol levels change as a result of the intervention.
The main thing was it helped me a lot to focus on my child. You know, like before I couldn't tolerate the crying and it would make me crazy. I used to be depressed. But now, I mean, sometimes I can't take it, but you know, I know better now.
What have we learned from the studies of early life adversity? What we've learned is to take it seriously, that these are real biological issues. That early attachment is vital to everything else that happens. Something that is an inevitable part of who we are as human beings.
Yeah, so they're even connecting it to the biology, like our biological response to how our cortisol level spikes. But I show you guys that in intro to social work also, I feel like I did, how childhood trauma affects health across a lifetime. And it's Dr. Nadine Burks. She's good. Have you seen it before? You may or may not. All right. So this is what I'm going to finish on, because this is probably the most important about trauma and how it affects.
I'm sure you've heard the news about the government sending out rebate checks. Any single person that makes $99,000.
But first, any questions about attachment and secure attachment before we move on with it? Maybe. What's that?
So basically, when we're younger, we're like attached to like our parents and stuff.
Whoever the caregiver is, yeah. So even if it's an adoptive parent, like one strong parent and parenting. And if you have that secure attachment, you'll have that in relationships throughout life. If we don't, we may have some things to undo with therapy, so to speak. You know what I mean? Like if we had a insecure avoidant attachment, like it may show up in relationships later on, which is like, wow, that's kind of crazy.
In the mid-90s, the CDC and Kaiser Permanente discovered an exposure that dramatically increased the risk for 7 out of 10 of the leading causes of death in the United States. In high doses, it affects brain development, the immune system, hormonal systems, and even the way our DNA is read and transcribed. Folks who are exposed in very high doses have triple the lifetime risk of heart disease and lung cancer, and a 20-year difference in life expectancy. And yet doctors today are not trained in routine screening or treatment. Now, the exposure I'm talking about is not a pesticide or pathogen chemical. It's childhood trauma. Okay, what kind of trauma am I talking about here? I'm not talking about failing a test or losing a basketball game. I am talking about threats that are so severe or pervasive that they literally get under our skin and change our physiology. Things like abuse or neglect, or growing up with a parent who struggles with mental illness or substance dependence. Now, for a long time, I viewed these things in the way I was trained to view them, either as a social problem, refer to social services, or as a mental health problem, refer to mental health services. And then something happened to make me rethink my entire approach. When I finished my residency, I wanted to go someplace where I felt really needed, someplace where I could make a difference. So I came to work for California Pacific Medical Center, one of the best private hospitals in Northern California. And together, we opened a clinic in Bayview, Hunters Point, one of the poorest, most underserved neighborhoods in San Francisco. Now, prior to that point, there had been only one pediatrician in all of Bayview to serve more than 10,000 children. So we hung a shingle and we were able to provide top quality care regardless of ability to pay. It was so cool. We targeted the typical health disparities, access to care, immunization rates, asthma hospitalization rates, and we hit all of our numbers. We felt very proud of ourselves. But then I started noticing a disturbing trend. A lot of kids were being referred to me for ADHD, or attention deficit hyperactivity disorder. But when I actually did a thorough history and physical, what I found was that for most of my patients, I couldn't make a diagnosis of ADHD. Most of the kids I was seeing had experienced such severe trauma that it felt like something else was going on. Somehow, I was missing something important. Now, before I did my residency, I did a master's degree in public health. And one of the things that they teach you in public health school is that if you're a doctor and you see 100 kids that all drink from the same well, and 98 of them develop diarrhea, you can go ahead and write that prescription for dose after dose after dose of antibiotics, or you can walk over and say, what the hell is in this well? So I began reading everything that I could get my hands on about how exposure to adversity affects the developing brains and bodies of children. And then one day, my colleague walked into my office and he said, Dr. Burke, have you seen this? In his hand was a copy of a research study called the Adverse Childhood Experiences Study. That day changed my clinical practice and ultimately my career. The Adverse Childhood Experiences Study is something that everybody needs to know about. It was done by Dr. Vince Felitti at Kaiser and Dr. Bob Onda at the CDC, and together they asked 17,500 adults about their history of exposure to what they called adverse childhood experiences, or ACEs. Those include physical, emotional, or sexual abuse, physical or emotional neglect, parental mental illness, substance dependence, incarceration, parental separation or divorce, or domestic violence. For every yes, you would get a point on your ACE score. And then what they did was they correlated these ACE scores against health outcomes. What they found was striking. Two things. Number one, ACEs are incredibly common. 67% of the population had at least one ACE, and 12.6%, 1 in 8, had 4 or more ACEs. The second thing that they found was that there was a dose-response relationship between ACEs and health outcomes. The higher your ACE score, the worse your health outcomes. For a person with an ACE score of 4 or more, their relative risk of chronic obstructive pulmonary disease was 2.5 times that of someone with an ACE score of 0. For hepatitis, it was also 2.5 times. For depression, it was 4.5 times. For suicidality, it was 12 times. A person with an ACE score of 7 or more had triple the lifetime risk of lung cancer and 3.5 times the risk of ischemic heart disease, the #1 killer in the United States of America. Well, of course, this makes sense. You know, some people looked at this data and they said, come on, you know, you have a rough childhood, you're more likely to drink and smoke and do all these things that are going to ruin your health. This isn't science. This is just bad behavior. It turns out this is exactly where the science comes in. We now understand better than we ever have before how exposure to early adversity affects the developing brains and bodies of children. It affects areas like the nucleus accumbens, the pleasure and reward center of the brain that is implicated in substance dependence. It inhibits the prefrontal cortex, which is necessary for impulse control and executive function, a critical area for learning. And on MRI scans, we see measurable differences in the amygdala, the brain's fear response center. So there are real neurologic reasons why folks exposed to high doses of adversity are more likely to engage in high-risk behavior. And that's important to know. But it turns out that even if you don't engage in any high-risk behavior, you're still more likely to develop heart disease or cancer. The reason for this has to do with the hypothalamic pituitary adrenal axis, the brain's and body's stress response system that governs our fight or flight response. How does it work? Well, imagine you're walking in the forest and you see a bear. Immediately, your hypothalamus sends a signal to your pituitary, which sends a signal to your adrenal gland that says, release stress hormones, adrenaline, cortisol. And so your heart starts to pound, your pupils dilate, your airways open up, and you are ready to either fight that bear or run from the bear. And that is wonderful if you're in a forest and there's a bear. But the problem is what happens when the bear comes home every night. And this system is activated over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health damaging. Children are especially sensitive to this repeated stress activation because their brains and bodies are just developing. High doses of adversity not only affect brain structure and function, they affect the developing immune system, developing hormonal systems, and even the way our DNA is read and transcribed. So for me, this information threw my old training out the window, because when we understand the mechanism of a disease, when we know not only which pathways are disrupted, but how, then as doctors, it is our job to use this science for prevention and treatment. That's what we do. So in San Francisco, we created the Center for Youth Wellness to prevent, screen, and heal the impacts of ACEs and toxic stress. We started simply with routine screening of every one of our kids at their regular physical, because I know that if my patient has an ACE score of 4, she's 2.5 times as likely to develop hepatitis or COPD. She's 4.5 times as likely to become depressed, and she's 12 times as likely to attempt to take her own life as my patient with 0 ACEs. I know that when she's in my exam room. For our patients who do screen positive, we have a multidisciplinary treatment team that works to reduce the dose of adversity and treat symptoms using best practices, including home visits, care coordination, mental health care, nutrition, holistic interventions, and yes, medication when necessary. But we also educate parents about the impact of ACEs and toxic stress the same way you would for covering electrical outlets or lead poisoning. And we tailor the care of our asthmatics and our diabetics in a way that recognizes that they may need more aggressive treatment given the changes to their hormonal and immune systems. So the other thing that happens when you understand this science is that you'll want to shout it from the rooftops, because this isn't just an issue for kids in Bayview. I figured the minute that everybody else heard about this, it would be routine screening, multidisciplinary treatment teams, and it would be a race to the most effective clinical treatment protocols. Yeah, that did not happen. And that was a huge learning for me. What I had thought of as simply best clinical practice, I now understand to be a movement. In the words of Dr. Robert Block, the former president of the American Academy of Pediatrics, adverse childhood experiences are the single greatest unaddressed public health threat facing our nation today. And for a lot of people, that's a terrifying prospect. The scope and scale of the problem seems so large that it feels overwhelming to think about how we might approach it. But for me, that's actually where the hope lies. Because when we have the right framework, when we recognize this to be a public health crisis, then we can begin to use the right toolkit to come up with solutions. From tobacco to lead poisoning to HIV/AIDS, the United States actually has quite a strong track record with addressing public health problems. But replicating those successes with ACEs and toxic stress is going to take determination and commitment. And when I look at what our nation's response has been so far, I wonder, why haven't we taken this more seriously? You know, at first, I thought that we marginalized the issue because it doesn't apply to us, right? That's an issue for those kids in those neighborhoods, which is weird because the data doesn't bear that out. The original ACEs study was done in a population that was 70% Caucasian, 70% college educated. But then, the more I talk to folks, I'm beginning to think that maybe I had it completely backwards. If I were to ask how many people in this room grew up with a family member who suffered from mental illness, I bet a few hands would go up. And then if I were to ask how many folks had a parent who maybe drank too much, or who really believed that if you spare the rod, you spoil the child, I bet a few more hands would go up. Even in this room, this is an issue that touches many of us. And I'm beginning to believe that we marginalize the issue because it does apply to us. Maybe it's easier to see in other zip codes because we don't want to look at it. We'd rather be sick. Fortunately, scientific advances and frankly, economic realities make that option less viable every day. The science is clear. Early adversity dramatically affects health across a lifetime. Today, we are beginning to understand how to interrupt the progression from early adversity to disease and early death. And 30 years from now, the child who has a high ACE score and whose behavioral symptoms go unrecognized, whose asthma management is not connected, and who goes on to develop high blood pressure and early heart disease or cancer will be just as anomalous as a 6-month mortality from HIV/AIDS. People will look at that situation and say, what the heck happened there? This is treatable. This is beatable. The single most important thing that we need today is the courage to look this problem in the face and say, this is real and this is all of us. I believe that we are the movement. Thank you.
Have you ever seen that one before? Okay. So as she's getting into, and this is our introduction to watching Paper Tigers next week, you know, the adverse childhood experiences are real, and it's something that we really do need to consider and, you know, keep in mind when working with kids that are, you know, of the young age, starting with the development and starting with attachment and things of that nature. And we'll get into some of Erickson's theory next week also, and just the different things that we go through and different ways we can test for it. So again, getting back to the point that, you know, stuff that happens to us as an infant or even in the womb or as a child, you know, does have the overall effect of mental health challenges or benefits throughout our lifetime. So, you know, as a social worker, we want to explore on assessment, ask those things about childhood and development and things that could have been a trauma growing up, if that helps make more sense. Any questions?